absolutely delighted to be joined by Professor Andrew Wardley, a highly respected, experienced, and internationally renowned consultant medical oncologist and breast cancer specialist. And delighted to say, Mr. Wardley, Professor Wardley, you're here to talk to us about the latest cancer treatments in the UK and how effective they are. So, before we get started, if you'd like to maybe provide a little bit of background information about your medical experience.
Yes, sure. Thank you very much. So I'm Andrew Wardley. I'm a breast cancer medical oncologist. I have 23 years of experience in breast cancer medicine. And I've been very fortunate to be able to be involved in the development of many of the cancer drugs that are very effective against breast cancer and have hugely improved the chances of survival for patients with breast cancer. And also for those who we can't cure, has greatly extended their life expectancy and their quality of life. So I'm very happy to have been able to help with those developments. And I've also helped with the developments of a lot of the services that lead to the delivery of these treatments, which is also very important.
Absolutely, Professor Wordley, fantastic. Thank you for the background information, and you have a lot of experience in cancer in the area of cancer research, cancer, breast cancer. So, some questions relating to that topic, with regards to treatments in the UK. So, what are the major factors that influence access to cancer treatments in the UK, and how do they affect patient outcomes?
So there is unfortunately wide variation in ability to access cancer treatments in the UK. And that's mainly due to the unfortunate situation that the workforce has not kept pace with the developments in drug therapies. So we've had an absolutely massive expansion in the number of treatments we can use in breast cancer, but also in other cancers. And that's put a huge strain on many services. So unfortunately, there aren't enough oncologists or other people who are involved in the delivery of care. And that has led to a major restriction for many patients being able to get the right access to the right people to have the right treatment at the right time.
Absolutely. I suppose, and with regards to the future, do you feel as though there will be improvements made in the near future, or will it be a number of years before there is a real patient satisfaction?
I think, I'm very pleased that there is finally an NHS workforce plan. There hasn't been one for 20 years, which you might very well unreasonably ask why not. But we do have one now. Unfortunately, that will take some time to result in new people on the ground who can actually deliver the care. So if we're looking at new consultants from the point of going into higher medical training, there's a minimum of 4 years to get to be a consultant. Unfortunately, we're not filling the places that we need to at the moment. So we are actively trying to find more people that would want to go into cancer medicine. It's a hugely exciting area of medicine. It brings together nearly every aspect that you might wish to partake in. If you were a doctor, you can take part in research, or you can get more involved in holistic medicine, complementary therapies. It's hugely exciting and diverse. So if we're looking at people coming out of medical school and having to go into their junior doctor training, which is where we need to get more engagement in cancer medicine because there's little exposure in that part of your career at the moment for many people. So they don't realize that cancer medicine is a great opportunity for them. That's 7 years. And if we're talking about starting at medical school, we're talking about 12 years. So we do have some way to go before we have the right number of people as oncologists. Also, there's the same challenge for training nurses, and pharmacists are hugely important in the delivery of cancer treatments. I think we do really need to think seriously about the configuration of the cancer care system in the UK. There isn't enough to go around. I think we do need to think about drastic measures to change how cancer medicine is delivered. Those conversations need to be started. as executive chair of the Association of Cancer Physicians, the body that represents medical oncologists. We've tried to start those conversations with the government, and we're working very closely with our colleagues in clinical oncology through the Royal College of Radiologists, cancer pharmacists through BOPA, and cancer nurses through UConn. So all of us are trying to have engagement, to have that conversation, to try and improve things in the short term.
Absolutely. Very, very promising indeed for the future, which is great to hear for patients, I suppose, diagnosed with cancer. And it leads nicely on then to our second question, which is how does the availability of cancer treatments vary across different regions in the country? And what steps are being taken to address any disparities?
So there's that variation is mainly due to the workforce distribution. There's more oncologists and other physicians in London, for instance. Also, Manchester is very fortunate in having a very high number of cancer specialists, oncologists. But if you look at the Midlands and the north and northeast of the country, there's a huge shortage. So we really need to think about how we are able to get better access for those patients because they have very long waiting times to get access to treatment. They're not necessarily seeing the right level of specialists because some of us who spent all of our lives treating one cancer are very, very experienced and knowledgeable in that area. Unfortunately, there are still some oncologists who are forced by necessity to still treat several areas of cancer. So they can't be as knowledgeable in every aspect of every cancer that they're trying to deal with. And I think we need to continue to try and improve the specialization of the oncologists within each cancer type, because every cancer type has huge and increasing demands of knowledge and understanding of the treatments that we use.
Absolutely. That's a very interesting point, Professor Wardley. The fact that I suppose there is kind of a multi-specialty or doctors aren't specializing in a specific cancer, which is a challenge, of course, for medical professionals like yourselves. And how do you overcome that challenge, I suppose, dealing with patients?
For me, I've been very fortunate that I've been lucky enough to be able to concentrate all my career as a consultant in breast cancer and be involved in all of the new treatments as they are developing. So being at the coalface, developing those treatments and helping implement them into service gives you that additional knowledge that you are very, very familiar with the challenges and the ways that these treatments need to be given to different types of people, because obviously some people are older and other people are younger, and we have those challenges as to what the best treatment is for each individual patient. And it's not as easy as just picking a recipe out of the recipe book, as it were, and giving it to a patient. We know that that doesn't always work very well, and I've seen that in the past where less experienced colleagues have found very unfortunate results from giving the wrong treatment to the wrong patient. And I don't think that's their fault personally. I think that's the challenges again of the system and the lack of support around them. So we need to work together, I think, and support each other very well as best as we can. But the more expertise that you have and the ability that you might have to ask the questions that you need to ask and be happy to do that, I think are things we need to all be aware of, that you can't be an expert on day one that you qualify. You have to ask for help. I certainly did that when I first qualified. I asked help from my colleagues across the national and international community. So I think that's hugely important.
Absolutely. Teamwork, I suppose, and everybody's in it as well as a team. Although medical professions, they'll specialize in different areas, but at the end of the day, they have the same objective, which is great. Absolutely fantastic. And then the next question, then, Professor Wardley, the main challenges faced by patients in relation to accessing innovative cancer treatments, and how can these challenges be overcome?
Yes, that's a hugely important and challenging question. So I think having a cancer diagnosis is devastating for most people. And suddenly you have to start talking a language that you don't know. And you're talking to people who are hopefully experts, and that in itself can be quite challenging because of the discrepancy and the imbalance in information and knowledge base. It's always challenging trying to speak to someone who is much more knowledgeable than you. I think for patients, they should ask all the time. If people are using words you don't understand, ask them to explain what they're talking about, and that I think is critical. And that's one thing that I've seen and trying to train and teach younger colleagues that I've had the fortune of being their mentors, is to how to put information across to patients in a way that's understandable and try and avoid medical jargon all the time. So I think the other thing is, don't be afraid to ask for a second opinion. It's if you want to check that you're getting the best treatment, everybody in the NHS is entitled to a second opinion. And there are also experts like myself around the country who are very happy to give second opinions to make sure that you are getting the right treatment. You don't have to come necessarily to have treatment with us, but we can give you that advice and reassurance that this is the right treatment for you in your particular predicament. And I think the other thing you should always ask about is, are there any clinical trials that I might go in? Because we know that clinical trials have been where we've developed these new fantastic treatments. And if you go into the trial, you will get the opportunity potentially to get the new next best treatment. But also you'll get excellent care, the very best care, because within a clinical trial, the demands and the organisation to deliver a clinical trial require a team working around you. And it is well recognised that in places where clinical trials happen, you're more likely to get a better quality of care, even if you're getting the standard care that you'll get anywhere else.
Fantastic, Professor Wardley. Absolutely fantastic. It's a really good point about asking the medical professionals to explain what they might be talking about, because medical terms can be quite intimidating, I suppose, for patients. So that's really, really good to hear somebody like yourself to, I suppose, to make sure that the patients are prioritized and make sure that they know exactly what they're getting themselves in for. So absolutely, really, really good. Thank you, Thank you, Professor Wardley. And then the fourth question then would be in relation to socioeconomic factors then, and how these factors affect the access to cancer treatments in the UK, and what strategies are in place to ensure equitable access for all patients.
So socioeconomic factors are very, very important. We know that people of lower socioeconomic classes are more likely to get cancer. They're more likely to be diagnosed later, and they get generally worse access to treatment. And that's multifactorial. I think there's also a close interconnected relationship between ethnic minorities often being in areas of high social deprivation. One of the biggest issues is the inability to speak the language of the NHS. Now, I'm not talking about medical jargon. I'm talking about the ability to actually get into the system, to navigate your way through the system. So people like myself who are familiar with this system, or other middle-class people, often know the right people to talk to and can get support and access through the system and get to the right place to get the right treatment. They're also more likely to be able to ask for second opinions or challenge doctors or nurses. Sorry, excuse me. Sorry. So they're also more likely to be able to ask the right questions, to have the ability to feel confident enough to challenge or ask for explanations when they're not clear what they're being told. So I think that is fundamental. And how can we improve that? Well, we need to directly engage with these people at places where they can be accessible, where they go to. So we can't just sit there and wait and say, well, it's there, come and get it. There has to be more direct engagement, and that might be in many different ways. It might be going to their places of worship. It might be going to their places of recreation. It might be going to their local community and just being available to be able to speak to them and make them understand what is available to them and try and help them access the right treatments.
Absolutely fantastic, fantastic answer, Professor Wardley. Again, really reassuring for patients. That's a really good point because depending on the social circumstance and the situation, it can be, well, people might be at a disadvantage. So that's really, really reassuring. Excellent. And then the next question then, how effective then, Professor Wardley, are current initiatives aimed at reducing waiting times for cancer treatments in the UK, and what further improvements can be made?
Well, that is a hugely important topic and needs serious thought. I think we've seen even before COVID that there was an increasing shortage of clinical staff available relative to the amount of treatments and therapies that needed to be given to them. And that, unfortunately, is continued. COVID certainly didn't help, but it isn't the cause of the problem. It uncovered a problem that was already there. And it is this workforce issue that is fundamental. And it is very, very important that people do access screening opportunities. But again, we know that there's this challenge, this barrier where lower socioeconomic groups and ethnically diverse groups are less likely to access the screening opportunities available to them. So a lot of work needs to be done in those areas at every level. It's not just down to the oncologists who are often very late in the game. I think we need to start with education in schools. We need to start with education in communities. We really need to make people aware of what is out there for them so that they can make use of it and hopefully get diagnosed earlier, because we know that earlier diagnosis gives you a much better chance of having effective treatment.
Absolutely. I suppose then, Professor Wardley, leading us on nicely to the big question, I suppose, of the interview. How effective are the current cancer treatments in the UK then? If you want to provide a little outline of the current cancer treatments and how effective they are, kind of a comparison.
We're very, very lucky in the UK that we have some of the best, doctors and nurses, and we've had in the past great access to the clinical trial opportunities, and we've helped develop a lot of the very exciting and effective treatments that are available for cancer patients. At the moment, there's no drugs that we're not able to access, but it comes back to that point I made earlier, is that we don't necessarily have the right number or type of specialist that we really need to make the very best use of the treatments that we have available. So I think we'd still need to work on that and to try and keep improving skill levels in our clinical community, but also increase the number of people that are available, and or rethink about how we deliver services across the UK so that there is more accessibility to these very good and effective treatments that we have.
Absolutely. Well, Professor Andrew Wardley, thank you so, so much again for your time and a very interesting insight into the current state of cancer treatment in the UK. And for anybody listening who's watching the video or listening on Spotify, if you'd like to check out the profile, the Top Doctors profile of Professor Andrew Wardley, you can head on over to www.topdoctors.co.uk and find Professor Wardley there and perhaps book an appointment with him to discuss any cancer diagnosis. And I'm sure Professor Wardley will be the right man for you, the right professional for you. So thank you once again, Professor Wardley, for your time.
Thank you very much.